Good evening, everyone. Welcome to the LUM CAA assessment. We are now on our final week, or week 10 of Module 2. Next week, we shall start with a new module. It's all about pattern differentiation. This is about mastery of diagnostic patterns or syndromes, no? Okay, so I hope everybody is prepared. And for tonight, I'm sure nobody will commit a mistake tonight. I think we have over 70 questions, and the type of exam is called the Morse type. No? So for those who are not familiar with this type of assessment, let me summarize it. So all the questions have a stem and 4 options, one or more of which may be correct. These questions are answered by using the following keys. Letter A, you answer A if 1, 2, and 3 are correct. So there are only 4 choices, four options. So if 1 and 3 options are correct, you answer B. If 2 and 4 are correct, you answer C. If only 4 is correct, you answer D. And E, all answers are correct. Since matatalino kayong lahat, masanay na kayo sa mga exam sa medicine, no? And whether you like it or not, we're actually making you getting used to. We would like you to get used to the medical terms and all. Okay, so we're not going to make you. We're going to do this gradually, especially when we start talking about the syndromes, the patterns. What we would like to do is for us to determine ano po yung mga concomitant medical conditions that are the equivalent of the patterns. Okay, so we are going to discuss all the Zhangfu organ patterns one by one. Although the most, so we would be infusing all the different, kasi ang dami when you say diagnostics, no? And this is what will set you apart from the others, okay? Because if you do not know diagnostic patterns, it's just like, ano lang, kawawa naman yung patient, di ba? Kasi if you cannot arrive at a diagnosis, you will not be able to have a treatment principle. So how can you treat the patient, di ba? Okay, and I'm very confident that based on our assessment sa lahat sa inyo, you are now prepared. And by the way, we will be announcing once you've taken all the practicum or the face-to-face with Dr. Webb, we're going to schedule a very, very simple if you have been joining us during the assessments. It's called the oral revalida, no? So we will just ask a question or two. We'll probably give you a case, and then you tell us how you're going to manage the case. And I tell you, if you have been religiously attending our assessment, then this will just be, one of those days. Okay, so let's study more. And as I mentioned earlier, the questions for tonight are actually just a review. Okay? So parang binago lang natin yung recipe. So as usual, I'm going to call on the earliest bird, who arrived. So I would like to call on Ma'am Angel Ko. Please take care of questions. Ilan ba kayo? 4, 5, 6. Okay. Questions 1 to 5. Or 1 to 10. Would that be okay? 1 to 10? Kaya ba, Miss Angel?
Sige
Go.
po. Good evening po, Doc. Classmate po. Good evening po.
Okay.
Okay, so number 1 po. Red complexion indicates, ang answer ko po sa number 1 is letter E, febrile disease caused by exogenous pathogens, excessive heat in the Zhangfu organ, deficiency heat caused by deficiency of yin and floating of yang. Yun po yung mga nag-aano po ng red complexion. So all of the above po yung answer.
Any comments? Okay, the answer is E. All of the above. Red complexion. This is a very simple question. Okay, may iba ba yung iba may iba pang answer? No? Okay, number 2, congrats. Good answer, number 2.
Number 2, bluish purple complexion is due to ang answer ko po, Doc, is letter B, stagnation of blood and severe pain. Kasi yung deficiency of blood
What
po
is
is
the yeah, okay. So your
Yeah.
answer is stagnation of blood.
and severe pain po. Kasi po yung deficiency of blood, pale complexion po yan. Pati yung stagnation of chi po.
Will you have a pale complexion in chi stagnation?
Light lang po, Doc, or parang walang pagbabago.
Wala mo. Okay. So the correct answer is
Is 1
B.
and 3.
1
B
and
po,
3.
Doc.
Very good. Bluish purple. By the way, can you tell us the difference between bluish purple and reddish purple?
Yung bluish purple po kasi, Doc, ano po siya, yung reddish po, more on heat po siya, Doc.
Stagnation is
Yung,
due to heat.
yes, Doc. Yung bluish purple po is, sa cold po siya. Stagnation ng, ano po siya, sa cold po, or pain po ng galing sa cold.
What is the earliest sign of blood stagnation? Are you going to rely on the color of the tongue or are you going to look somewhere else?
Yes,
Kasi,
valid, Doc, sa ano po, sublingual vein po, Doc.
oh, wow, very good. Oh my God, I'm so proud of you. Thank you.
Thank you po, Doc.
Isko. Okay, you're all good. Grabe. Okay, number 3.
Number 3 po, pale complexion is linked with, answer ko po is letter A, deficiency of blood, deficiency of Qi, tsaka deficiency of Yang. Kasi po yung number 4, deficiency of Yin, is ano po yan, mapula-pula po yan sa pisngi, Doc.
Pag yin deficiency. Like,
Yes po,
ano ba
Doc.
yung ano ba yung
Baga malar
okay,
flash
let's
po
go
siya, Doc.
to excess heat and or excess yang and yin deficiency. Ano pagkakaiba when it comes to color of the face?
Yung excess heat po, Doc, bali, ang color po ng face niya is red.
Okay.
Tapos, deficiency of Yin po, chicks lang po yung red.
Pisngi lang yung red.
Yes po, chicks lang po ang red. Pisngi lang.
Okay,
Ano pa po?
color flash.
Apo,
So,
malar flash
hindi mo
lang.
pwedeng sabihin na pale complexion ang deficiency of yin.
Yes po, Doc. Kasi po mapula po yung pisngi niya, Doc.
So your answer is
Letter A po, yung 1, 2, 3 po.
so how are you going to like diba, all 3 deficiency of blood, deficiency of Qi, deficiency of yang will show pale complexion.
Yes po, Doc.
What will be your basis in terms of tongue diagnosis?
Bali yung tongue po niya is
Like blood deficiency.
blood deficiency po. Ang tongue po niyan is pale. So, same with deficiency of Qi. May pale din, tapos may teeth marks. Si deficiency of Yang naman, pale din, tapos medyo wet kasi parang nagkaroon siya ng dampness, gano'n. Or malapit nang magka-dampness.
Okay, going back to blood deficiency.
Yes, Doc.
Okay, aside from pallor or pale tongue, sabi mo kasi sa deficiency of Qi, pale tongue plus may teeth marks, no?
Apo.
And then sa deficiency of yang, pale yung tongue plus moist.
Apo.
Am I right?
Yung deficiency of blood po, Doc, yung body shape po niya is thin. Thin
Okay.
po.
Bakit kaya siya naging thin?
Kumbaga yung na-absorb po niya kasi na parang,
Nutrients.
apo yung parang nutrients or what sa blood. Kulang sa parang,
Okay. Anong pagkakaiba ng yang deficiency tongue sa blood deficiency tongue?
si yung deficiency po, Doc, kasi, ano po to kulang sa heat. So, sa deficiency of blood po siya.
Sabi mo kanina, moist yung tongue
Apo.
sa yang deficiency.
Apo. Kulang po siya sa ano, sa,
Anong
kumbaga,
pagkakaiba niya sa blood deficiency?
si blood deficiency kasi, Doc, dry po siya, yung tongue niya.
Okay. Dry and thin.
Apo, dry and thin po.
Mhm. Okay. Good. Let's go to number 4.
Number 4 po, pale complexion indicates, answer ko po, Doc, is all of the above po, Doc. Yung
Okay.
deficient syndrome, cold syndrome, collapse of blood, tsaka collapse of chi.
Okay. This is easy, no? Any
Yes po, Doc.
comments? Good. Number 5.
Number 5 po, a normal tongue is, answer ko po is letter E po, Doc. All of the above din po, kasi light red in color, free in motion, thin white puntig, tsaka proper size. All of the above po, Doc. Number 5.
What do you mean by proper size?
Kumbaga, hindi po siya swollen and flabby, Doc.
Hindi siya swollen, hindi rin siya maliit.
Yes po, Doc. Hindi rin siya thin. So, normal size lang siya, Doc.
Bakit pa naging light red ang normal color ng tongue?
Kumbaga, pinkish lang siya, Doc.
Yeah, bakit siya naging, di ba? So it's between pale and red, right?
Opo.
Ano? A pink parang kulay ng fresh meat. Ang
Opo.
tanong ko, bakit naging ganun ang kulay ng tongue?
Bakit?
Okay, if you remember, when you say, ibig sabihin red siya na naging
Opo.
putla. Kasi
Opo.
may kinalaman dito ang yung coating, yung ano, 'di ba? Like, yung tinatawag nating residue ng food. Remember? 'Di ba meron kayo kaya that pallor, that plus the red, hindi na siya red, naging pink na siya. Kaya pale red. Okay? So if it's neither pale nor red, it could be purple. Ganun
Yes,
lang.
Doc. Purple po. Pagka may stagnation.
So pag red siya, extreme yan siya ng pale, di ba? Okay. Good. So thin white coating. It's because of the thin white coating. Okay. Number 6.
Number 6 po. A yellow complexion indicates, answer ko po, Doc, is number 2 po and 4. Bali letter C po. Down syndrome and deficiency syndrome po. Kasi kapag yung number 1 po, heat syndrome, red po yan.
Okay.
Ito namang wind syndrome po, Doc, hindi rin siya. So, ang yellow po kasi, so kung Down syndrome, ibig sabihin may problem po siya sa spleen. So, yellow complexion po siya. Ngayon, kung deficiency syndrome naman, bakit naging dilaw? Baka po blood deficiency siya, Doc.
Okay, talking about deficiency syndromes, di ba meron tayong bright yellow and dull yellow? Ano pagkakaiba in terms of pathology? Take note, when you think of bright, something positive, right? When you think of dull, it's something deficient. Something. Okay, whatever. Baka mas lalo nang confused. Okay. So meron tayong bright yellow and dull yellow. And you need to know the pattern. Anyway, we're going to take that up during the patterns or during the syndromes. Okay, mastery of syndromes. Okay, so good. Let's go to number 7.
Number 7 po. The tip of tongue often reveals the pathological change of, answer ko po is yung number 1 po yung heart, tsaka yung lung. Bali letter B po, Doc. Kasi yung spleen sa center siya, tsaka yung stomach.
Okay. Yung lung ba, tip ba ng tongue or behind the tip?
Ano siya, Doc? Sa tip rin po, kasunod ng heart.
Bakit magkasunod ang heart and lung? Bakit magkaano? Like, can you tell me another way of dividing the tongue? At saka bakit magka-partner si lungs and heart?
Partner po kasi silang tsaka si Heart. Kasi pareho po silang nasa taas po.
Nasa upper burner
Opo,
or
kumbaga upper
upper
burner
jaw.
po sila. So
Okay.
silang, pag nag-ano po siya ng chi, pupunta rin po siya kay Heart.
Okay. Mhm. So, pag yung tip ng tongue
Yes, Doc.
nagsuslope downward, what does it mean? Di ba may tip ng tongue na umaakyat? Meron ding iba, pababa.
Opo.
So if the tip of the tongue slopes downward, that's probably a deficiency condition of the heart. So it could be blood deficiency or qi deficiency, no? Pero pag ano naman siya, pag naka-ano, it's usually excess. Okay, but anyway, you're going to learn all of that when we talk about syndromes. Number 8.
Number 8 po. A pale tongue indicates, answer ko po is deficiency of,
Ulit lang ito no?
opo, nauna na po siya kanina.
I-delete natin to. Sorry.
Opo.
Number 9.
Number 9 po. A red tongue indicates, answer ko po is letter B, na bali 1 and 3 po, heat syndrome of excess type, tsaka heat syndrome of the deficient type. Kasi yung 2, blood syndrome, pale yan, tsaka itong si deficiency syndrome po. Iba rin po.
So ibig
So,
sabihin, magkakaroon ka ng red tongue on both heat syndrome excess type and heat syndrome deficient type.
yes po, Doc.
Okay, can you tell us more about itong heat syndrome of the deficient type? Bakit siya nagkaroon ng heat?
Kumbaga, nagkaroon siya ng heat kasi parang na-yin deficiency siya, Doc eh.
Okay, bakit?
So,
Kailan mo masasabing mayroon siyang yin deficiency?
kunwari may problem siya sa spleen, Doc.
Okay.
So, nagkaroon siya ng dampness.
Okay.
Yes po.
Ano yung ano natin? Ano yung basehan natin when we say yin deficiency? What do you look for in the tongue?
Bali red tongue po siya, Doc.
Red tongue ka agad, yin deficiency?
Ano po muna,
Anong pagkakaiba ng qi deficiency tongue? Or let's talk about stomach qi deficiency and
ano po siya,
stomach
Doc?
yin deficiency.
No coating po siya, Doc.
Okay. What about stomach qi deficiency? Ano ang itsura ng coating?
Parang rootless coating, Doc.
Okay, very good. And stomach yin deficiency?
Ano lang siya, Doc? Konti lang, little coating lang or wala.
Partial loss or
Yes po, Doc.
absence of coating.
Yes po, Doc.
Alin ang mas malala? Ang stomach yin deficiency or stomach qi deficiency?
Ano po, yung stomach yin deficiency, Doc.
Okay. Pag may stomach yin deficiency ka, does it necessarily mean na red na kaagad yung tongue?
Stomach yin deficiency, Doc, no? Maaring yung ano lang, Doc.
Kailan
Hindi
siya
po.
magiging red? Or if you have stomach yin deficiency, does it always mean na yung tongue mo is red?
Stomach yin deficiency. Pwede rin ano, Doc, may crack lang.
So hindi siya red.
Hindi, pwedeng hindi red, Doc.
Kailan mo siya masasabing naging red yung tongue?
Kapag ka nagkaroon na po siya, Doc, ng excessive heat po.
Empty
Or,
heat.
opo, empty heat po, Doc, or ano, full heat po, Doc.
Eh, bakit magpo-full heat ka agad?
Ay, hindi po. Empty heat po muna, Doc.
Okay. So, pag red na yung tongue mo, aside from the stomach, aling zangfu organ pa ang involved?
Liver, Doc. involved na rin po, tsaka yung spleen.
Ano yung pinaka-common?
Nagkakaroon po ng
Where do you most likely see a red tongue? Pag meron kang kidney yin deficiency or stomach yin deficiency?
kidney yin deficiency,
Okay.
Doc.
Kasi very chronic na.
Opo, Doc.
Okay, good. Number 10.
Number 10 po, a deep red tongue indicates letter B po, Doc, yung extreme heat condition, pati yung hyperactivity of fire due to deficient yin. Kasi yung number 4, ano po ito, stagnation of blood, so purple po siya.
Okay, what about number 2?
Interior excess syndrome. Hindi po kasi nasabi, Doc, kung cold syndrome ba siya or heat syndrome po ba siya, Doc.
Wow. Okay.
So, enough ko na
Ano,
rin po.
can you discuss to us the pathology ng hyperactivity of fire? Posible ba to? Like, kanina we were talking about yin deficiency na nagkaroon ng empty heat. It will take several years or even 10 years for the empty heat to kasi pag sinabi mong empty heat, red na po yung coating, yung tongue, no? No more coating. So may possibility na hindi pa red yung tongue pero wala nang coating. Yun yung natawag nating stomach yin deficiency. But pag mayroon ng empty heat, red na po yung tongue. Okay. Paano nagkaroon ng fire?
Yung ano, Doc, naapektuhan na po yung heart kasi yung kidney, pag nagkaroon ka na po ng kidney deficiency, so hindi na po niya na ano ng si heart, hindi na po niya nakokontrol. So, nagiging fire na po siya.
So, ibig sabihin, if you see a red tongue, fire na fire, ang ibig sabihin nun, affected talaga yung kidney.
Affected, Doc, kasi siya po yung, kumbaga yung kidney yun po kasi malaki po yung ano niya ganap niya. So, siya rin yung nag-aano ng heart, siya may connection din siya kay liver. So pagka na ano po yung kidney, yin, malaki po yung effect. Talagang magiging red na po yung tongue.
Ano ang normal relationship ng kidney and heart?
Kidney and heart po, kumbaga si kidney kasi, Doc, di ba yung kidney yin niya? Kumbaga siya yung nag-aano kay heart na water and fire. So siya yung nagbibigay ng, siya yung nagkukul kay heart. So kapag nawala yung nagka-problema kay kidney yin, si heart magiging fire na siya.
Okay,
Kasi
what
kulang
about
na yung pagpapalamig niya eh.
Okay. Yeah. Paano naman yung mga yung malalapad yung tongue, maputla? What happened there?
Malalapad yung tang at maputla. So, nagkaroon na po siya ng ano, Doc. Kung lumapad na po yung tang niya, so, parang nagkaroon na siya ng
Ano lang mahina, yung heart o yung kidney?
heart, Doc. Kasi
So,
parang,
hindi
ano siya, Doc,
kakayanan ng heart. Okay, very
yes,
good.
parang yung pag-pump niya, Doc, hindi na, ano, so, nagkaroon na ng deficiency.
Okay. You just passed the revalida for module.
Nakaka-ano, Doc, ha?
Okay, thank you.
Thank you, Doc.
Congratulations. Wow, good job. Excellent job. I'm very proud of you. So let's call on our next parang ready na si Ma'am Ami. Okay, Ma'am Ami, are you ready to answer 11 to 20? Bawal dito
Okay, Doc.
magkamali Okay, good.
Bawal, Doc,
Magkamali.
Yes, Doc. Okay, number 11. A pale, purplish, and moist tongue is related to one, extreme heat condition, 2, accumulations of cold, 3, deficiency of yin, 4, stagnations of blood.
Mm-hmm.
Pale, purplish, and moist tongue is related to accumulations of cold and stagnations of blood.
So, 2 and 4. Letter C, no?
2 and 4. Dahil po ang pale po siya for cold and dahil merong stagnation sa blood, may purplish po ang tongue.
Okay.
Hindi
Um,
po siya pwede ng extreme heat condition dahil heat nga po and then deficiency of yin. Hindi rin po.
okay.
Ah,
Okay. Di ba familiar ka na sa pulse diagnosis na Ma'am Ami, di ba?
medyo po.
Okay, wag medyo, dapat familiar na. Tapos na tayo sa
Opo.
diagnostics, di ba? Okay. This is just common sense. Okay, sabi mo kasi, accumulation of cold and stagnation of blood. So,
Okay.
paano mo mako-confirm using the pulse na cold?
Ang cold po, pale po siya.
No.
Weak po.
I'm talking about the pulse.
I mean, sleep, naka-ano lang po siya, naka-float lang po siya.
Are
Hindi
you
po siya
sure naka-float? Naku, it's a mortal sin, ma'am. Ano?
accumulations of
Huwag ka
cold.
mag-tense sa akin. Diyos, kakakatakot pa yung mukha ko.
Hindi po, teka,
Di
Doc,
pala- Diyan na
accumulations
naman yung
of
sakit
cold,
mo,
nasa
ma'am.
exterior
Ma'am
pa lang po
Ami.
siya. So, nasa exterior pa lang po siya, cold, nasa, ano pa lang po, ibabaw pa lang po, Doc.
Hindi. Pag may accumulation of cold, do you expect a deep pulse or a superficial pulse?
Superficial pa lang po.
Take note, this is accumulation of cold. Ibig sabihin, matagal na yung cold.
So, deep na po pala.
Okay. What about stagnation of blood? Ano yung pulse quality pag blood stagnation?
Ang ano po, parang choppy po siya.
Okay, wag parang you have to be
Choppy
definite
po.
with your answer.
Bali, yun nga po, hindi siya dire-diretso.
Okay. Anong itsura ng tongue pag extreme heat?
Red po. Deep red po, deep red.
Okay. You were talking about red or extreme heat. Okay, di ba? What about yin deficiency? Ano ang itsura ng tongue?
Ang yin deficiency po is red po,
With empty heat.
with empty heat. And then no coating.
Yeah. Automatic yan. Pag walang coating, it's yin deficiency. Pag
Yes,
sinabi
no.
mong red yung tongue, actually, pag sinabi mong yin deficiency, most authors would say it's a red tongue body.
No.
Ang tanong ko ganito, di ba red din sabi mo pag extreme heat? Anong pagkakaiba ng dalawa? Pag extreme heat na tongue, saka yin deficiency with empty heat. Ano yung magiging basehan natin?
Ang bali pagka-extreme po, medyo, kumbaga sa ano, nasa stage na siya ng chronic. Yung mas malalala na po siya. Extreme na siya,
Ano yung
sobra.
hahanapin mo para hindi mo siya masabing, or in other words, how are you going to differentiate yin deficiency with empty heat from extreme heat?
Extreme heat.
Sobrang heat. Would you find a thick coating pag extreme heat?
At extreme heat po, Doc, is ano, medyo thickness na po. Makapal na po siya.
Thick yung coating.
Yes po. Thick na po
Ano
yung
ba
coating.
yin deficiency with empty heat? Gaano kakapal ang coating?
Slight lang po.
So slightly makapal ang coating ng yin
Yeah po.
deficiency with empty heat.
Mhm.
Do you want to comment, Miss Angel? So
Doc.
ibig sabihin may coating pa ang yin deficiency with empty heat. Remember, pula na yung tongue. So ibig mo sabihin may coating pa yung yin deficiency with empty heat?
Empty.
Natitense
Kasi
ka na
sir,
naman, Ma'am Ami.
Kasi po, sa yin deficiency nga po is wala na pong coating eh.
Oo nga, so
So,
bakit mo sinabi kanina, bakit konting ka pa lang? So you
Opo.
should be very, very sure of your answer. No? So ang pagkakaiba, may coating yung extreme heat.
Extreme heat. Yes.
Anong kulay ng coating?
Meron na po siyang yellow coating.
Good. Number 12.
Number 12. A blue purplish tongue, dry and lusterless, is related to stagnations of blood, accumulations of cold, extreme heat, and deficiency of yin. My answer, Doc, is 1 and 3, stagnations of blood and extreme heat. Again. Mukha po kanina.
Kanina, sinabi natin, pag blue-purple tongue, it is blood stagnation due to cold, right?
Yes po.
So, is it possible na ang moist na tongue magiging dry? Is it
Possible po.
possible?
Possible po.
Actually, everything will turn to heat.
Yes po.
Lahat, all types of emotions, this will all give us heat. Remember, di ba? Pag sumobra na yung, naabot na mo na yung pinaka-extreme ng heat, magiging yin na naman yan. So, pag naabot mo na yung extreme na yin, magiging yang. Kaya nothing is permanent. Okay? So, your answer is letter B, 1 and 3.
Letter B, 1 and 3.
Number 13.
Number 13, a swallow tongue indicates yang deficiency of the spleen and kidney, retentions of fluid, phlegm, and dampness, excess heat in the heart and spleen, and toxicosis.
Okay.
The answer, swollen tongue indicates.
Toxicosis, toxic heat.
All the answer is correct, Doc.
Why?
Swollen tongue indicates retentions of fluid, phlegm, and dampness. Dahil po may damp na, so makapal na po yung tongue. And then excess heat in the heart and spleen. Swollen na rin po. And nagkaroon na rin po ng toxicosis for infection. So, indication pa rin po ng swollen tongue.
Okay, anong itsura ng tongue sa excess heat in the heart and spleen? Anong kulay ng tongue dyan?
Ang excess of heat, red po.
What will be your basis?
Nagre-red
Red
po
and
siya.
swollen.
Okay. Yes po.
So all of the above. Okay, very
All
good.
of the
Number
above.
14.
A cracked tongue indicates excess heat consuming body fluids, deficiency of blood, deficiency of qi and yin, invasion of pathogenic wind. The answer is number 1, 2, and 3. Cracked tongue indicates excess heat consuming body fluids, deficiency of blood, and deficiency of qi and yin.
Anong itsura ng tongue pag merong invasion of wind?
Ang invasions of wind po is
Let's say wind cold.
ang wind cold po is pale. Pale po. Pero yung invasions of
No, wait lang. Nagpapanik ka na, Ma'am Ami. Okay. Do you remember our lecture on wind heat and wind cold? Invasion of pathogenic wind. Ibig sabihin, nakakasakit. Example, pumunta ka sa isang lugar na malamig. Ano yung una-una mong mapapansin sa wind cold? Are you going to see a change in the tongue, coating, or none at all? Wala, di ba? Naka-focus tayo sa coating, di ba? Remember, this is invasion. This is acute. Huh?
Okay.
Acute yan. You should remember that. What about wind heat? What did you learn about invasion of wind heat?
Red po. Red tongue.
Are you sure red ka agad? Red tongue is already interior. That's already chronic. This one is very acute pa. Okay, you should know the difference. This is wind invasion. Okay, nor you wouldn't see a red tongue yet. However, pag tingnan mo yung tip pati yung sides, remember, meron ka makikitang red spots. And this is more common amongst the children. Kasi super young, lalo na pag mga toddlers, no?
Okay.
Makikita mo, meron na mga pula-pula sa sides and the tip. That's invasion of wind heat. Okay? It's called pathogenic wind kasi nakakakos ng sakit. So invasion.
So manifested more outside. Doc.
Anong more?
It manifests more outside.
Kaya nga invasion eh. Invader. Galing sa labas. Okay?
Opo.
Okay, so your answer is A. Okay, number 15.
A thin 18 tongue indicates deficiency of yang, deficiency of qi and blood, deficiency of spleen, and deficiency of yin. The answer is number 2 and 4, which is letter C.
What causes a thin tongue? Pag naging thin ba ang tongue, ano ibig sabihin nun? Nakulangan ng
Kulang po siya ng deficiency of
nutrients, no? Nakulangan
Yin.
siya ng yin. Nakulangan siya ng nutrients.
Mhm.
Katulad na niya ng ano, kaya nga these days, kaya I'm so, andito na si Dr. Sam. Congratulations, Dr. Sam. You're now a naturopathic doctor. And I bow my head to all of the naturopaths there. Kasi parang feeling ko talaga, no, kompletong-kompleto na kayo, no? Kasi you would know what to recommend, what food to suggest, right? Kasi acupuncture alone is not enough, no?
Yes.
And I'm very excited to kita ko yung mga mukha nyo excited na rin. Di ba ang galing yun na mag-ano sa mukha, yung AcuLift?
Yes, Doc.
And I'm very sure even the PITAC is monitoring our assessments. And if you remember, this is already our 20th week. No, we started March 6th. And I'm sure they've seen how good you are. And I was thinking, kasi, you know, let's face it, there's still something kulang, di ba? I'm sure you felt it. Like there are cases whereby, like especially to mga yin deficiency. When you talk about yin deficiency, you talk about nutrition, no? And I'm very excited na I met someone who is so, kasi ang trend kasi ngayon, di ba, more on nourishment and
Yes.
even alam ko ang daming food supplement ni ano, pero let's be more globally, shall we say, ano, 'di ba, yung mga yung ba parang mga serum, yung mga ganon. Kasi ewan ko lang nagsidatingan sila. In fact, when I was in Manila, I met yung si ano, 'di ba? Hindi lang tayo magme-mention. Hindi ata siya nag-a-attend, but anyway, so naging curious ako. Parang kasi there are cases, like example, if you have lalo na pag medyo payat na payat yung tongue. So we need nutrition. And so I'm excited na, di ba gusto natin yung mukha mo, like, you know, magiging, ano to? How would I call it? Of course, all of us wouldn't like to look old, no, di ba?
Yes.
Oo. Okay, let me ask you, Dr. Sam. Pause muna tayo. And by the way, Sir AK, you'll be the next, number 21 to 30. Okay, so di ba maganda yung ano, like may papahid ka dyan, tapos to keep it, you know, and at the same time, grabe yung absorption. So siguro, let's open our minds to some latest in technology. And I'm also excited ng mga food supplement din ni ano. Ang maganda kasi, aside from the fact na nakita nila yung change, like, di ba, you love working on the lines, you need, and this is where I think the expertise of Dr. Sam will come in. Marami na po kasing mga innovations ngayon, no? Oo. So, yan ang pag-uusapan natin siguro in a next. Are you excited? Oo. So, dapat tayong lahat, lumiit yung mga mukha natin. Yung bang, pag tinanong ka, ay, ilang taong ka na? Then, sige, guess my age. Hindi yung sasabihin, 1 year lang ang bata. Parang wala naman. Dapat mga 5 years, 10 years, diba? Oo. So, yun yung dito tayo nagkulang. Kasi yung acupuncture kasi sa Philippines, wala pang mga herbs, no? Wala kasi expert na ano. Kaya, I'm excited to really, what's this? Learn from Dr. Sam yung mga advancement in your nutrition, in your food therapy, whatever. And we need to be updated with a lot of things, no?
Yes, actually, Doc, sa discussion namin with Dr. Lin doon sa lab during our training,
Hmm.
yung nabanggit niya kasi na not all in the Philippines discussed about nutrition.
Yeah.
Yeah. Then I am just also glad that
Yeah, he
Richter.
would incorporate. Yeah, he told me about it. Excited
Yeah,
ako kayo. Let me be honest. Although may konting alam ko sa nutrition yung basic eh. So, alam mo naman tayo medyo na ano. Ang acupuncture kasi will give you the yang. No, we
Yes.
all know that. So we need something that's yin para balance. Excited na si Sir AKO. Sige, let's talk about it. So, pero in the meantime, so let's try to kasi I'm trying to. Would you be open to attending some like yung ba parang galing sa labas, mga European Oo. So para medyo mas maganda yung ating flow, no? But we will still be using the Zoom and it's para medyo mag-level up na tayo, 'di ba? Okay. So yon. Sorry for the interruption. Are you still there, Ma'am Ami?
Yes po, Doc.
Okay. So yung sagot mo is, this reminds me, kaya dapat yung thin tongue, kasi pag manipis yung tongue mo, wala na nutrition, tuyong-tuyo na. So we need to do something. Kasi there are cases, especially when we start talking about the patterns, no? Like if you follow the book of Machocha, medyo there are cases na we need to do something else. And this is where I need the help of Dr. Sam. Okay.
Okay.
Number 16, Ma'am Ami.
Okay, Doc. The clinical significance of deviated tongue is early sign of wind stroke, invasions of the heart by pathogenic heat, 3 wind stroke, and sunstroke. Early sign of wind stroke and wind stroke.
Okay, very easy. Ano ba itong sunstroke? Does it make sense? Heat stroke.
Medyo hindi na po siya masyadong mailabas.
Okay. Let's go to number 17.
17. The early sign of wind stroke on the tongue is deviated, flaccid, rigid, and cracked. Deviated and rigid.
Okay. Matigas and nakatiko. Okay, number 18.
Number 18, a rigid tongue indicate invasions of pericardium by heat, retentions of turbid phlegm in the interior, excessive pathogenic heat consuming body fluid, and wind stroke.
Okay.
All the answer is correct, Doc.
Okay. Okay, this is a bit interesting because makikita mo talaga anong impact ng internal heat, no? Invasion of the pericardium by heat. So ito na yung kasi yung pericardium is supposed to protect the heart, right? So it can impact right away. Kasi lalo na pag mahina talaga yung meron ka ng comorbidity. Okay? And also the turbid phlegm in the interior. And we all know that the phlegm can actually impact your chi and blood. Okay? Kaya ang dami-dami po niyan. Okay, ang tanong ko Ma'am Ami, aside from a rigid tongue, what would you expect to see in a tongue that has retention of turbid phlegm?
Swollen po.
What else?
Swollen and then
It's a bit rough, no?
rough na po siya.
Okay, kasi phlegm na. Okay, number
Phlegm.
19.
A white tongue coating indicates normal, exterior syndromes, cold syndromes, and damp syndrome. Answer is 1, 2, and 3.
What about Down syndrome?
Normal. Ang damp po ay heat siya, so
Heat? Damp?
ang damp po ay nag-yellow coating po siya. Dahil meron siyang phlegm. Damp syndrome.
Does it always have to be yellow?
Then, ano po siya ulit?
Ano ba? Like, when do you say na damp yung syndrome? Are you going to look at the color or something else?
Bali makapal na po siya. Makapal po.
Do you remember the slippery, no? Slippery, madulas.
Slippery, madulas.
And kasi it could be damp heat, it could be damp cold. Okay, number 20.
A white.
Ito na, sticky. Sticky or slippery.
A white, thick, and sticky tongue coating indicates retentions of phlegm, retentions of undigested food, retentions of cold, damp, and stagnation of chi. 1, 2, and 3.
What about
Retention.
chi stagnation? Ano ang tongue coating niya?
Ang
Would you see
chi
anything?
stagnation.
Would you see any change?
Wala naman po.
Okay, good. Maraming salamat, Ma'am Ami.
Thank you. Thank you, Doc.
Wag mong
Thank you very
ipahalata
much.
na nervyos ha. You did well.
Yes, Doc. It's okay lang po.
Pag nati-tense kasi dapat masanay na kayong manginig, no?
Opo, ano lang po minsan. Pero okay na po ako.
Okay, wag kayong pabudol ha. Okay.
Opo. Thank you, Doc. Thank you very much po.
Thank you. So let's call on before I call on Sir AK, I would like Ma'am Lane Arandia to be prepared for 31 to 40.
Okay po.
Okay, Ma'am Lane. Okay, Sir AK, na nakikita ko parati sa lectures ni Dr. Webb.
Good evening, Doc.
Good
Good
evening.
classmate.
Grabe kayo ha,
Good evening
kahit kahit inulan. You know, nag-usap kami ni Dr. Webb eh. He's so ngayon lang siya nakakita ng mga estudyante na who will brave the rains, the floods just to learn, no? Iba kasi pag face to face, 'di ba? So yun.
Opo, Doc.
And I'm sure you learn a lot from basic anatomy, yes? And then sabi niya, marami na raw kayong alam kasi most of you are LMTs. Okay. So I think kinonect niya yun sa mga points. Okay, anyway. Okay, Sir AK?
Okay, Doc.
21.
Number 21. A dry tongue coating indicates deficiency of yin, deficiency of body fluid, deficiency of yang, qi, which fails to transfer fluid. Number 4, deficiency of blood. My answer, Doc, is letter A, the 1, 2, 3, except the deficiency of blood. For number 21.
Okay, huwag kayong ma-confuse dito ha. This is coating, not the tongue body ha. Okay, pag ang pinag-usapan ba, okay. Can you explain to us bakit dry ang tongue coating ng deficiency of yang qi, which fails to transfer body fluid? Is this kasi when you say dry tongue coating, definitely hindi siya moist, no?
Yes, Doc.
So, anong nangyari dito? Deficient yung yang qi. Di ba pag sinabi natin deficient ang yang qi, what do you expect the coating to be? Would it be dry or moist? Or do you have here a situation in which a moist tongue coating eventually turn to heat? Is
Medyo
that
nakakalito nga yun, medyo nakakalito nga yun, Dok, kasi pag deficiency of yang chi, I think may pagka-moist to eh.
Oo, pero 'di ba ang yang pag yang deficient ka, ang yin, syempre pag sinabi mong yang chi deficiency, that's yin. It can turn to yang, right? 'Di ba sinabi
Yes,
ko
Doc.
kanina, everything will have to turn to heat.
Yes, Doc.
Okay. Everything will have to turn to heat. Lalo na pag hindi mo siya na-expel. Katulad ng mga nangyayari sa, wag na lang baka matakot na kayo magpa-vaccine. But anyway, pag may mga yung mga unresolved na issues, no? Hindi na ialis. Kaya that's the reason why some would always have the problem. Nagme-maintenance na, no? Kasi nagkaroon ng latent heat because because of hindi
Pag hindi,
naalis
Doc,
yung pathogenic mo.
nag-move, it turn to heat eh. Diba?
Yes, everything will turn to heat. O, di ba, like, okay, pag naging moist siya, yin siya. Di ba pag sumobra na, di ba, pag matagal ka ng yin, natutuyo ka rin.
Yes,
Remember,
Doc.
yung intertransformation. No? Katulad, okay, ito namang deficiency of yin, this is obvious. However, hindi naman siya kaagad matutuyo eh. Of course, there will be dry tongue coating with, at saka this is a bit misleading. Wala namang coating ang yin deficiency, di ba? But
Dito, Doc, sa number 3, doon sa tanong mo na deficiency of yang chi fails to transfer body fluid, parang ang imagination ko dito, hindi nakakapag-replenish yung particular dating doon sa katawan natin, hindi siya nakakapag-replenish ng fluid. That's why nag-stuck siya, then madadry siya, matutuyo siya definitely.
Oo.
Para siyang yung relationship ng yin at yang, ng fire at ng water, na parang yung fire, para lagi siyang may apoy, kailangan lagi siyang may gatong, and then yung gatong niya kailangan lagi siyang nare-replenish. Then definitely pag hindi nangyari yon, magkakaroon siya ng parang heat, overheat, ganon, kasi madidrain yung kanyang fluid.
Eventually, nagtatransform. Nagtatransform siya. Okay, in the same way na pag ang yang din, nagiging yin. Pero everything will have to turn to yang. So giging yin, tapos balik na naman, ganun. Just like when you have fever, no? Di ba pag na-infect, nagkasakit ka, of course, pag nag-fever ka, mataas yung yang mo, what will the yin do? Iko-kontra niya yon. Kaya papawisan ka. Diba?
Yes, Doc.
So ngayon, pag pinatagal mo yung fever niya, pinaabot mo ng 5 araw, no? So ibig sabihin, medyo madidehydrate ka na. So ang gagawin natin, bilisan na natin. So patataasin mo na yung heat, paano mo na yung fever para matapos na. Kasi para maging yin na siya. Do you follow? Ang nangyayari kasi ngayon, sinusuppress natin yung fever. Right? So this is where the challenge lies, no? Your ability to actually
ang idea, Doc, ganito yung sa binabanggit mo, yung understanding na minsan mali yung conception natin na pag yung may fever tayo, sinusuppress kagad natin siya, which is dapat hindi, kasi part yun nung galaw ng katawan natin. Ang dapat na gawin is lagi lang mag-hydrate, para hindi tayo ma-dehydrate, para hindi ma-dry yung ating katawan, yung yin natin.
Yun nga. Kaya may mga unsettled business pag inagapan mo kaagad yung diba? Ibig sabihin, hindi mo na inalaw yung sarili mong yin Kasi pag yung fever mo ang tagal-tagal na, napapagod na rin ang napapagod na rin yung yin. So natutuyo ka. Do you follow? Kasi ganito yan, mainit, no? May fever. Aakyat si yin, kaya papawisan ka. Ang gusto natin mangyari, mabilis umakyat si yin. Okay? Kasi pag tinatagal mo yan, yung fever mo hindi na-resolve kasi hindi ka marunong mag-acu. So, ano mangyayari? No? So, ang layo. So, si yin, mapapagod din yan, ma-exhaust. Okay? Kasi yung fever hindi matanggal-tanggal. So, bakit hindi mo na lang, hindi mo na lang i-tonify yung heat? Li11, remember? Ito-tonify mo, hindi mo i-sedate. Parang i-assist mo na siya mag-fever para matapos na. Para matapos na yung ano na yon, yung stage na yon. Okay? Kasi pag pinatagal mo pa yung fever niya, mapapagod si yin. So you become dehydrated, you become thin, you become, ganon. Okay, but anyway, it's another story. We're going to tackle that during treatment principles. Okay, let's go to number 22, Sir AK.
Okay, number 22, an obese patient with mental depression suggests deficiency of Qi, deficiency of Yang, excess of phlegm dump, number 4, retention of food. Except, doc, 4. So my answer is letter A, 1, 2, 3, deficiency of Qi, deficiency of Yang, excess of phlegm.
Okay, what's the difference in terms of symptomatology between Qi deficiency and Yang deficiency? Which came first, Qi deficiency or Yang deficiency? Second question. Yeah.
I think Qi deficiency.
Okay, very good.
Doc.
Yeah, Qi deficiency. So ngayon, paano mo i-differentiate ang Qi deficiency sa Yang deficiency? Sa Yang deficiency ba, kasali ba dyan ang Qi deficiency? So kung kasali siya, ano pa yung iba mong mga hanap?
Doc.
Ano pa yung element na hahanapin mo para masabi mo na Yang deficiency talaga siya?
Sa Yang deficiency, Doc, kung sa Qi kasi wala pang masyadong mapapansin. But in Yang deficiency, may coldness na to eh.
Okay. Got it.
But
You're very good.
Doc,
Done.
possible nagkaroon ng Doc before yung Qi deficiency kasi kung mental depression, that is Qi stagnation.
Okay.
Before Qi deficiency.
So, pag obese patient ba, is that phlegm?
Definitely, Doc, yes.
Okay.
Damp.
Okay.
Damp phlegm.
Very good. Good. Number 23.
Doc. Number 23, disturbance of the eye by liver wind may show 1, upward staring, number 2, straightforward staring, 3, sideways staring, 4, yellow sclera. Kasi Doc, pinag-uusapan is wind, except number 4 again, yellow sclera. The answer, Doc, is letter A, 1, 2, 3.
So,
it's about movement.
Okay, very good. Liver wind. Nakatutok lang, nakatitig lang. Kaya yung mga grabe mag-stare, most probably meron silang liver wind na affected na yung eye. Number 24.
Number 24. Redness and swelling of the throat with yellow or white ulcer spots are due to excessive toxic heat in the lung and the stomach. My answer, Doc, is 2 and 4, the lung and the stomach. Swelling ng ng throat, redness, swelling of the throat with the yellow or white ulcer. Excessive toxic heat.
Bakit nakasali si stomach dito? Anong connection? Okay, let me go back first. In terms of channel, I'm not talking about the partner.
Yes, Doc.
Nung
Lung
polarity,
and
lung and what?
lung
And?
and large intestine.
No, lung and
Lung and
spleen.
spleen.
Yes.
Lung.
Oo, pero ang problem kasi dito, meron ka ng excessive heat. So, doon ka sa young partner ni spleen. Actually, pag sinabi mong spleen, it's understood na you're also referring to the stomach. Diba?
Oh. Yes, Doc.
Yeah? Okay.
The
So,
partner.
you don't
Organ.
include the spleen here. Okay. Number 25.
Number 25, redness and swelling of the gums are due to flare-up of stomach fire, Doc. It's stomach channel.
Okay, what's the best point for dealing with the stomach fire?
Stomach
Remember
fire.
the five shoe points?
Yes, Doc.
Stomach what?
Stomach 40, 44.
Very good. Wala akong masabi kay Sir AK. Wow. 26.
Alala lang, Doc. Number
Ay, ganito
26.
ha. Ganito. Di ba tinatanong-tanong ko na kayo yung iba nag-ano. I will not do what's this? I will not give revalida to those who I feel can answer the revalida questions. Okay? So dapat walang walang masasaktan if we like siguro mga kung hindi this year baka next year when we're done with the clinics. If we ask you to have the revalida, that means medyo kailangan pa talaga mag-revalida. Do you get what I mean? Oh, kasi bakit ako magre-revalida sa mga taong alam ko masasagot din yung question, di ba? But don't worry, it's the revalida that really points. Okay. Actually, ito pa lang ganyan ngayon, itong mga pinagagawa natin, alam ko na kung sino. Okay? Saka walang favoritism dito ha. Okay. 26.
26. Blue purplish lips suggest retention of cold and stagnation of blood, Doc. That is 2-4, and that is letter C. My answer is letter C.
Yeah, very good. Number 27.
Number 27, sweating is present in exterior syndrome, interior syndrome, deficient syndromes, excessive syndromes. All of it, Doc. The answer is letter E. All of the answer is correct.
Okay.
Lahat siya.
Let's go to number 3, deficient syndrome. Paano nagkaroon ng sweating sa deficient syndrome?
Just like Doc yin deficiency.
Yeah, you got it.
Night sweat.
I know you know the answer. Very good. Okay, 28.
Number 28, profuse sweating caused by the total exhaustion of yang is often accompanied by restlessness, feeble breathing, cold limbs, deep and 3D falls. And all of it, Doc, my answer is letter E.
Okay.
Lahat po ito.
Okay. So ito yung parang naghihiwalay na si yang sa yin ha. Yang collapse na to. Do you follow? Okay.
May pagka-chronic na to, Doc.
Hindi lang chronic, malapit na. Kasi lalo na pag may mga oily sweat na yan dito sa may forehead. Okay? Tapos yung breathing niya malapit na yan. Tapos hindi mo na mapalpate yung pulse. masyado ng manipis, no? Malalim na siya and manipis. So of course, cold limbs, parang malapit na talaga. Okay? So profuse sweating is not a good thing. Okay? Especially if it's, So I hope you don't encounter these patients, but since we're all headed towards that direction, and I'm sure we can do it. So who knows? We will be educating the medical people in the hospital. Diba? So let's aim big, let's aim high. And I know we can do it. Okay, 29.
29. The causes of spontaneous sweating include weakness of yang and deficiency of defensive chi.
Anong ibig mo sabihin sa spontaneous sweating?
Spontaneous.
Is it the sweating na kahit hindi mainit?
Oh, yes, Doc.
Okay. Spontaneous, di
Yes,
ba?
Doc.
Hindi mainit.
Opo, Doc.
Okay.
Oo.
Paano nangyari yon? What causes the sweating? Okay. Are you talking about skin pores here, di ba? So pag
Yes,
yung
Doc.
skin pores mo hindi nagsasara, what does that mean? Does it mean that your chi is deficient or your chi is strong?
Deficient definitely, Doc,
Okay.
kasi
Hindi
hindi niya
nagsasara.
nakokontrol eh. Oo, tsaka ito rin yung pag yung defensive chi natin is mahina. Ito rin yung prone tayo dun sa mga exterior pathogen. Mabilis po tayong magkakasakit kasi wala tayong depensa eh.
Sino
So siya yung may control.
Sino nagko-control kay defensive chi?
Lang, Doc.
Wow.
Definitely.
Okay. Ang galing. Okay. Next.
Okay. Last one, number 30 is spontaneous sweating is usually accompanied by listlessness, lassitude, worsening upon slight insertion, afternoon fever. My answer, Doc, is 1 to 3, except the number 4. Lahat ito, Doc, yung
Hello, Dr.
spontaneous sweating.
Gabino. Ang gagaling nila, Doc. Gising pa pala si
Yeah,
Doc.
sorry.
It's
Kahit di
okay.
po ako eh.
Sige. Pwede kayo magtanong, Doc. Ang gagaling nila.
Ay,
Grabe.
ako, di po makikinig lang po ako.
Okay. Huwag kayong mako-conscious. Okay lang yan. Okay. Hello, Doc. Mukhang Sige. Okay. Sir AK, where does afternoon fever fit in? Sir AK?
Yes,
Nawala.
Doc. Yes,
Oh,
Doc.
yeah, okay.
Yes, Doc.
So sabi mo, yung sagot mo dyan, 1, 2, and 3. So letter A. Bakit mo tinanggal si afternoon fever?
Usually, ano ba to? Yung afternoon fever, Doc, is ano siya eh, mga yin deficient na tao.
Bakit siya tinawag na afternoon fever?
Dahil ba, Doc, sa ano, yung meron siyang low grade fever in the afternoon.
Actually, it's not really fever eh. Maano lang, mainit lang. Hindi talaga siya fever. That's a misnomer. Pero since mainit yung pakiramdam niya, yeah,
Yes,
okay.
Doc. Sa TCM kasi 'di ba yun yung description niya, Doc. Yung fever na dinidescribe niya is
Okay.
not necessary fever sa Western medicine na umabot ng 38
Okay.
degrees Celsius. So,
So,
isa siyang pakiramdam na mainit.
okay. So meron tayong tinatawag na daytime sweating. Ito ba yung sinatawag mo na nighttime sweating, your night sweating? Anong pagkakaiba? Ano ang pattern could be involved? Like when you talk about daytime sweating.
Yung night paano ba? Yung night sweating
Kaya mo
kasi,
yan.
Doc, is ano siya eh, it's like ano siya eh, kahit na hindi mainit yung panahon, kahit night na siya, nagsusweat ka because yung AC mo sa katawan, yung cooling capability mo is wala. So that's why yung mga taong yin deficient o parang sira yung air condition niya sa bahay, nagpapawis siya sa gabi. Kahit hindi naiinitan yung mga normal na tao, siya naiinitan siya dahil wala siyang cooling capability.
Okay. Are you familiar with yung circulation ng Wei Qi, defensive Qi?
Yes, Doc.
Okay, can you tell us ilang beses siya nagsisirculate sa isang araw? Let's say sa daytime, sa isang araw.
Hindi ko alam, Doc, yung
Favorite
number
ito ni
niya.
Dr. Gabriel. Naalala ko kasi
Sorry,
tuloy.
Doc.
This will be your assignment, okay?
Okay, Doc. Okay, Doc.
Yeah, okay. Find
Okay,
out
Doc.
how many times does it have to. This is the reason why bakit yung ibang tao pinapawisan paggabi.
Okay, noted, Doc.
So you give us the answer next week when we talk about syndrome.
Okay, Doc.
Okay. Thank you, Sir AK. You did very well. Mukhang grabe.
Thank you, Doc.
Yeah. Okay. Let's go to Ma'am Lane Arandia.
Good evening po.
Good evening. Okay, I'd like sige, bago tayo sa si 41 to 50 will be taken care of by tanungin ko pa kaya si Okay. Sino po ba yun nandito? Ay, wala si Okay. Si Ma'am Lynn, will that be okay? 41 to 50? Okay.
Yes,
Sige, go
Doc.
ahead. Okay, go ahead, Ma'am Lane.
Number 41, night sweating caused by a deficiency of yin is usually accompanied by tidal fever, number 2, chills, 3, a red tank with little coating, shortness of breath. Kapag night sweating tapos caused by a yin deficiency, ito yung 1, 2, 3, tidal fever, chills, a red tank with little coating.
Anong ibig sabihin po ng tidal fever?
So, with cold po yun, Doc.
Ano?
Tidal. Pathogen, tidal fever, ano po
Bakit
siya?
ito tinawag na tidal fever?
Fever in the afternoon po.
Is this
And
similar?
low grade. Similar po siya sa low grade fever.
Ano ba yung klaseng fever sa TCM diagnostics? Di ba meron tayong high fever? By the way, how do you know if it's really high? Meron tayong tidal fever, may low grade fever. Okay, anong example mo? Kailan mo masasabi na high yung fever? This is very important.
Pag pinagpapawisan na siya.
Ilang degrees Celsius?
Pag nasa 37 pataas.
37?
39.
39.
39. Yeah. 39. And what about low grade fever? So yun na siguro yung 37, 38, no?
Apo, yung 37 to 38 low grade fever.
O saan pumapasok si tidal fever? Ito na yung fever in the afternoon?
Sa heat, over ano na po siya, yung over ano ba tawag doon?
Bakit siya
Sobrang heat na
mga
po siya.
taong may yin deficiency? Sabi mo kasi dito, kasi in-include mo si tidal fever, di ba? Night sweating caused by deficiency of yin. What is happening here? Bakit siya nagkakaroon ng tidal fever pag deficient ang yin? Saka bakit sa afternoon?
Pag yin tidal fever, pag yin deficiency po, nagmamanifest na po yung yang niya, yung heat.
Kulang na siya sa yin, di ba?
Opo. Kaya nagmamanifest na po yung heat sa katawan niya. Kaya nag-chills na rin siya. Tapos yung tank niya,
Chills?
red na red.
Sabi mo, hindi mo
May chills.
sinama si chills.
Ay, 1 and 3 lang pala. Tidal fever
Bakit
and
nagkakaroon? Okay. Let's go
tidal
back.
fever and
Okay, definitely this is not like you don't have chills pag ano ka lang, 'di ba? Pag night sweating, no? Bakit ba nagchi-chills ang tao? Kailan nagchi-chills?
pag ano po, Doc, pag nagkaroon siya ng wind cold.
Wind cold, wind heat? Yeah, okay.
Opo.
So sa wind cold, mas maraming chills kaysa sa fever.
Opo, yung wind cold po kasi may chills, no fever, tapos no sweating din. Tapos yung heat naman, more on sweating din siya. Tapos, ayun, may fever.
Okay, let's go back to wind cold invasion and wind heat invasion, 'di ba? Okay, paano mo ma-differentiate yung dalawa in terms of tongue?
Pagka cold, pag sa
Wind
wind cold po, white po yung coating niya eh.
Is it a coating na like malalaman mo ba kaagad pag wind cold just by looking? Ano ba normal coating ng tongue?
Pale, ano po siya, pale red. Pale red
Oh,
yung,
coating, the coating.
ang coating niya pag normal, thin white coating po siya
Okay,
daw.
so kung meron siyang wind cold invasion, do you expect to see a change right away? Remember, this is very
Hindi.
acute. Yes or no?
Wala po.
Wala. Okay. So what will be your basis? Yun lang ba yung hanapin mo? Titingin lang tayo sa tongue or meron tayong itatanong aside from the chills and fever? Pag magkaroon ba ng invasion of wind cold, saan ba yung pasok niya? Bakit meron tayong tinatawag na mga wind points? Usually, anong nangyayari? Siguro naman, nagkasakit ka naman siguro before, na-expose ka sa
Yes
malamig
po.
at sa mainit.
Opo.
Saan una mo napapansin yung problem?
Sa ulo po, masakit yung ulo,
Saan banda sa ulo?
sa batok, gano'n.
Sa batok. Bakit
Opo.
kaya? Bakit kaya sa batok?
Una-una po sa mga muscles, sa joints, doon po siya na-atake. O kaya nagkakaroon po siya ng inuubo o kaya sinisipon.
Okay. Punta tayo sa wind heat invasion. Anong pagkakaiba? Ano yung magiging sintomas ng patient?
Kapag wind heat po, may fever, milder chills, sweating, may headache. Tapos sa wind cold naman, chills, tapos yun po,
Wind
may
heat. Ituloy mo. Anong itsura
wind
ng
heat.
sa wind heat invasion?
May headache, may sweating, may milder chills, fever.
Ano
Tapos,
pa yung isang sintoma na wala sa wind cold? Para malaman natin na talagang wind heat. May mafe-feel ka ba sa lalamunan?
sa wind cold ho, may scratchy throat. Tapos sa wind heat, may sore throat.
Okay. Now, let's go to the tongue. Ano itsura ng tongue pag may wind heat invasion?
Red po siya, Doc. Kasi
Red
heat na po.
kaagad? Invasion pa siya, ha? Invasion pa siya.
Red, tapos wala pa po siyang coating.
Bakit bigla ka agad nalawalan ng coating? Hindi, wag ka ma-confuse sa, we're not talking about yin deficiency, we're talking about wind heat invasion. Okay. Sabi mo kanina, pag wind cold invasion, walang makikita sa tongue. It's still thin and white coating. So, what you can probably is more nag-chill, no? At saka ano pa, is it, di ba malamig yung pakiramdam niya? Madali mo bang mawala yung lamig niya?
Hindi,
Nawawala ba kahit magbalot siya ng or hindi nawawala?
hindi po.
Hindi nawawala. Okay, balik tayo sa wind heat. Sabi mo mas maraming fever kaysa chills. Anong itsura ng tongue?
Kapag pag medyo
Wind heat invasion. Acute pa siya. Di ba may makikita kang red spot saan?
red spots sa sides, tsaka sa
And
tip.
sa tip. Okay.
Opo,
Kailan mo
sa
malalaman na nag-interiorize na yung
pag nag-interior na po siya sa loob.
paano? Saan na pumunta yung pula? Yung
Sa
red?
spleen stomach
Okay, sa center.
center.
Bakit may chills and fever pag may invasion? Di ba bakit may fever tapos may chills pa? Bakit yun?
Sa wind cold po, may chills with low-grade fever.
Yeah, pareho, di ba? Sabi mo kanina, pag wind cold, mas maraming chills kaysa sa fever. Pag wind heat, mas maraming fever. Mas matindi yung fever kaysa chills. Pero both are present. Ang tanong natin is, bakit ganon?
Kasi kapag wind cold po, Dok, malamig, kaya mas nachi-chills siya. Mas giniginaw po.
Bakit may chills and fever sa dalawa? Like, ano ba? Like, this is invasion. Ano ba normal reaction ng ng iyong immune system? Yung tinatawag nating natawag dito, defensive chi.
May weak po yung ano niya, lung chi.
Mm,
Kaya yung defense switch niya is deficient.
is it easy for the wind heat or wind cold to invade if you have a deficient syndrome?
Pag may na po yung ano niya, defense switch niya, madali po siyang kapitan po ng ito pong mga pathogen, yung mga invasion.
So, ibig sabihin, normal lang po yun na nagkakaroon ng fever and chills. Kasi may nangyayaring sagupaan, di ba? May struggle between the pathogenic factor and the anti-pathogenic chi, right? Is it possible for someone with a good immune system to get sick? Let's say,
Hindi po.
pupunta ka ng North Pole, ang lamig-lamig, sanay ka sa mga maiinit. Magkakasakit ka ba kahit malakas ang immune system mo?
Pag nasa malamig po na lugar, possible
Kahit
po siya
healthy ka,
na,
magkakasakit ka.
opo, kung malamig na lugar po, possible kung pasukan ho yun ng kakaroon ho siya ng invasion.
Sino mas kakapitan ng... Sige, di ba? Okay, anong pagkakaiba ng excess sa deficiency?
Pag excess po, excess sa, excess yan po ba?
No, excess lang sa deficiency. Di ba pag nagpupulso ka, malalaman mo kung excess or deficient? Yes?
Opo, kapag deficiency ho, mabagal ho siya eh.
Mabagal?
Yung pulse.
What do you mean by mabagal?
Slow po yung pulse niya.
Are you sure?
Wait lang. Pag rapid po,
Wait lang, huwag ka ma-confuse. Pag sinabi mo bang excess, ano yung description mo sa pulse? Is it something forceful or forceless?
forceful po siya, yung excess, and yung forceless is deficient.
Synonymous ba sa mabilis ang forceful?
Mabilis, rapid po siya.
So pag rapid
pulse.
yung pulse mo, anong ibig sabihin no? Immediately what comes to mind?
Full hit po.
Okay.
Rapid.
Heat. Heat. Wag full heat ka agad. Kasi it could be, it could be deficient, no? Or empty heat, or it could be full heat. Okay, just say heat. Okay. Did you start practicing pulse diagnosis?
Yes po, Doc. Yung unti-unti lang po dito sa bahay.
Okay. Sige po. Let's go to number 32.
The presence of thirst indicates letter C, yung consumption of body fluid, tsaka itong retention of phlegm dump in interior. Ayan po yung indicate po na nagte-thirst po siya. Kasi kung pag deficiency of yang, so yung nagmamanifesto yung yin
Hindi siya
factor
thirsty.
nitong
Wala
yung
siyang
consumption.
Bakit walang thirst sa Qi deficiency? Kasi di ba parang yang deficiency din yun, early stage?
Yes po, Qi tapos yang po.
Is it possible na thirsty ka pero hindi ka umiinom ng madaming tubig?
Ano lang po siya, yung sip lang po sa yin deficiency naman po siya.
Okay, very good. So number 33.
Poor appetite caused by a weakness of the spleen and stomach is often accompanied by 1 loose stools, 2 lassitude, 3 a pale tongue with a thin white coating, and 4 regurgitation. Ang answer po, pag poor appetite, weakness of spleen and stomach, itong loose stools, lassitude, a pale tongue with a thin white coating.
For
Letter
your
A.
answer,
Letter A, 1, 2, 3.
saan nagbibilong si sour regurgitation?
Sa liver.
Sour regurgitation? Ano bang
Sa kidney po pala.
kidney?
Wait.
Ano ba? Like,
Pag maasim.
ano ba to? Yung parang bumalik yung asim? Ano yan? Is it a normal thing or is it a sign of okay. Have you heard of acid reflux?
Acid. Yes po. So regurgitation, acid reflux.
Okay. Anong pattern po ng stomach ang andoon? Kasi para siyang bumalik, di ba? Umakyat. Ano ba ang normal flow ng stomach chi?
Downward po.
So
Kaya
what
kapag
happens when you have sour regurgitation? What is wrong with the stomach chi here?
ang si liver, ano tawag dito? Nagkaroon po ng rebellious po yan eh. Tapos,
Okay, rebellious stomach chi. Most probably caused by
liver.
a lot of things. Okay. Usually the liver. 34.
Poor appetite due to a retention of pathogenic dampness is accompanied by stiffness in the chest, fullness in the abdomen, thick sticky tongue coating, and soft pulse. Poor appetite. Yung all of the above, ito pong 1, 2, 3, and 4. Kasi pag may dampness po, may thick sticky coating.
Stuffiness. What do you mean by soft pulse?
Ano siya? Sagi po siya eh.
Soggy.
Opo.
Ano bang pagkakaiba ng soggy sa deficient pulse? Or are they the same?
Yung sagi, superficial ho siya. Thin tsaka soft. Pag pinush mo, mawawala. Wala ho siyang substance.
Okay. And yung deficient? Deficient pulse.
Deficient po, ano siya, yung meron dito.
Alin ang mas mararamdaman mo? Ang soft pulse o ang deficient pulse?
Deficient po, kasi yung sagi, ano siya, wala ho siya talagang, nawawala ho siya pag nagpupus tapos wala ho siyang Opo.
Okay, anyway, sige. Masyado na tong cruel. Okay. 35.
Number 35, constipation due to dryness of the stools usually indicates pag constipation, dryness. Ito pong number 4, number 2 and 4, letter C. Constipation, yung may accumulation of heat, tapos consumption of body fluids. Itong letter C.
Okay. Na-consume yung body fluid because of the heat.
Opo.
So what will be your treatment principle dito?
Clear the heat po siya, Doc. Constipation.
Dissipate the heat?
Oo, yung i-clear po yung yung heat niya. Kasi constipation po siya, constipated po siya eh.
So based on the pulse, what are you going to look for?
So kapag heat po siya, rapid po siya.
Okay. 36.
Number 36, loose stools often suggest deficiency of the spleen, stagnation of chi, retention of dampness, or retention of food. Letter B, yung 1 and 3, deficiency of spleen tsaka retention of dampness.
Okay.
Kasi po, yan nga po yung pag-loose stools, deficiency of spleen. Tapos, ganun din, may retention of dampness.
Okay. The dampness is due to the spleen deficiency, no? So, anong itsura ng stool pag may chi stagnation?
Maliliit po siya, parang katulad ng sago.
Okay, very good. 37. Nakakagulat yung mga galing nyo. Grabe. Okay, 37.
Clear urine with increased output indicates infirmity of kidney chi. Number 2, retention of damp. 3, dysfunction of the bladder in controlling urine. 4, invasion of the bladder by heat. Ang sagot ko is number 1, tsaka yung 3. Clear urine with increased output indicates. So, related po siya sa kidney chi, tsaka po sa urinary bladder na nagko-control po ng urine.
So, ano yung magiging mo dito? Treatment plan, treatment principle. If you have a patient na clear yung urine, puting-puti, walang color, no? Tapos madami. Ano yung gagawin mo? Kasi sinabi mo, infirmity of kidney chi, and we all know that the kidney chi has something to do with the ability of the bladder to control urine, di ba? So anong gagawin mo? Can you give us a sample treatment? So definitely you would like to improve the kidney chi, right?
Codify the kidney chi po daw.
Okay, like how are you going to do that?
Sa kidney.
Ano yung pinaka-favorite natin? Like, obviously, this is a chronic thing, no?
Opo.
Do you agree this is a chronic thing?
Yes po.
Kidney chi infirmity. So, pag may chronic issue tayo, ano yung ipa-prioritize mo?
Sa back shoe po yung
And what
bladder.
back-shoe point are we talking about?
Bladder 23 ba yun?
What else? Are you not going to think of the Mingmen fire?
Pwede rin po kasi sa yung niya, yung bladder niya po.
Okay. Ano pa po? Like, hindi ba natin, ano ang back shoe ng ating bladder?
Ang back shoe po ng bladder is bladder 28. Tapos yung sa kidney is bladder 23.
Wala akong masabi. Okay. What about front mo? Are you going to also do something about the front mo?
Ang GB25 po sa kidney. Tapos rentry. Bladder naman, front mo naman po ng bladder is
Nakakapangilabot
rentry.
yung tanongin. Ready. Oh my God. Okay, number 38. Okay, 38.
Downward infusion of damp heat into the bladder would cause 1, scanty yellow urine, 2, urgent urination, 3, painful urination, 4, enuresis. Ang answer po is 1, 2, 3, scanty yellow urine, urgent urination, and painful urination. More on damp heat po sa bladder.
What is urgent urination?
Hindi mo mapigilan mo yung
Talagang
pag-ihi niya.
lalabas na.
Opo.
Ito naman, bakit mo hindi sinagot si enuresis? What is enuresis?
Enuresis, ano po siya, urinary incontinence, loss of bladder control. Is the loss of bladder control.
Ito ba yung sinasabi nating bedwetting? So naiinit
Yes po.
na tama.
Parang yung mga bata.
So ano po ang pathology doon? Would you have the same pathology here? It's definitely not damp heat, no? Kasi hindi
Hindi
pa
po.
sinaba, no? So ang tanong ko ngayon, ano makikita mo sa tongue pag may damp heat in the bladder? Are you going to see a thin white
Pag may damp heat po, ano siya yellow po.
yellow coat? What about the coat? Are you just going to say yellow? What? Paano mo prove yung dampness sa tongue?
Ano pong ano?
Is it
Ano nga?
slippery or
Slippery po pag ano
slippery, sticky coating?
Sticky or
Okay.
slippery.
Okay. Where? In the lower burner, no?
Opo, sa karot.
Okay. So pag may damp heat in the urinary bladder, about the pulse, are you familiar with the 3 positions, no? The Tsun, Kwan,
The tune 1 and
Sure. May konting R, sure. So, yung sure, yung kidney, di ba? Kidney
opo
ang
doon.
Okay, una-una, pag pinulsuhan mo siya, ano yung una-una mo mapapansin kung may damp heat? Mabilis yung pulse o mabagal?
Medyo mabagal ho siya. Mabilis pala.
Mabilis. Will it be slippery?
Slippery.
Okay.
Forceful.
Yeah, let's go to dribbling urination.
Dribbling urination is due to impaired function of the kidney of controlling urine, G dysfunction inhibiting activities of the bladder due to downward infusion of the damp heat, 3 stagnant bladder stones. Letter A po, Doc, itong 1, 2, 3. Dribbling urination, may kidney, sa kidney,
Mahina
impaired
ang
yung
kidney.
function ng kidney niya. Tapos yung dysfunction ng bladder, ayun po, yung
Actually, ang bladder function nakadepend po sa kidney chi, di ba? Oo. Kasi ito naman sinasabi natin kidney chi not firm. Kaya nagdi-dribble siya. Okay?
Okay.
Number 40.
Number 40, retention of urine is usually caused by G dysfunction inhibiting the activities of the bladder due to downward infusion of damp heat. Number 2, G dysfunction inhibiting the activities of the bladder due to downward infusion of stagnant blood. 3, G dysfunction inhibiting the activities of the bladder due to downward infusion of stones. Yung number 1, 2, 3 po, Doc, kasama po pala yung kidney chi, exhaustion of kidney chi.
So
Yung
parang
all of the
summarize
above.
mo na yung topic natin, no? Andiyan na lahat.
More on about po sa kidney, mga dysfunction
So,
ng
these
kidney
are
tsaka
possible
blood.
causes of retention of urine.
Opo.
Okay. If it is due to stagnant blood, what are you going to expect in the pulse?
Pag blood stagnation, ano ho siya? Blood stagnation. Ano po siya, Doc? Choppy. Choppy po yung pulse niya. Or rough.
Okay. Thank you very much, Ma'am Lane.
Thank you po.
You did very well. Talagang nag-aral. Okay, sige. Maraming salamat po. Okay, let's go to Ma'am Lynn. But before Ma'am Lynn, I'd like Dr. Sam to prepare for 51 to 60. Okay? So, kukunti lang tayo ngayon. Ewan ko ba dahil ba sa signal? Okay. Hello, Ma'am Lynn. Are you ready?
Yes po, good evening.
Okay. Mukhang may bagyo pa sa inyo.
Malakas lang yun, Doc.
Ay, malakas ang ulan.
Naririnig.
Oh my God. Oo, o sige, buti yun. At least live na live tayo.
Naririnig ko yata yung patak sa labas. Okay po.
Sige po.
Number 51. The typical sign of pain caused by tree stagnation is or are number 1, heavy sensation with pain. Number 2, descending pain. Number 3, burning pain. Number 4, pain with moving from place to place.
So your answer is?
Symptom ng stagnation po ay descending pain at yung hindi fixed na pain. So, letter B ang answer. At
Okay,
letters pala.
descending and moving from place to place. Migratory, palipat-lipat, no? Okay. Pag hindi mo na-resolve yung chi stagnation, ano po mangyayari na pattern? Hello, Ma'am Lynn? Ano po yung end result ng chi stagnation? Kasi sinabi mo like, so pag hindi nag-move, nag-stagnate si chi, eventually, sino ba yung kasabwat ni chi?
Liver.
No. Sino yung partner ni chi?
Blood.
Blood.
There will be blood stagnation.
Kakaroon ng blood stagnation, di ba? So pag blood stagnation, ano yung magiging characteristic ng pain?
Pag blood stagnation, fixed pain.
Fix. Okay, very good.
Yung pain ay
Sobbing.
piercing or shock
Yeah.
or boring.
Okay, very good. Okay, 42.
Number 42. Headache may be caused by, number 1, disturbance of the clear-young by pathogen.
Hmm.
Number 2, deficiency of Qi in blood which fails to nourish the head. Number 3, blockage of the channels by stagnation of Qi and blood. Number 4, retention of food. The disturbance of the clear-young of the cause ng pain.
So what's your answer?
So that yung 1, 2, and 3, pwedeng mag-cause po lahat ng headache. Letter A po.
Okay. Let's go to 43.
43. Lumbago may result from disturbance of the clear-young, retention of food, obstruction of the channel. So, lumbago is low back pain. Definitely may deficiency sa kidney and obstruction of the channel. So, my answer is letter
Letter?
C po. Deficiency of the kidney and obstruction of the channel.
Okay, very good. Very easy questions. Number 44.
Number 44. Chest pain indicates pathologic changes in the heart, the brain, the lungs, or the kidney. Definitely for chest pain, heart and lung po yan, Doc.
Okay.
Letter
Parating magka-partner, no? Okay, 45.
Hypochondriac pain is linked with stagnation of Qi in the liver, stagnation of blood of the liver, damp heat in the gallbladder, damp heat in the spleen. Hypochondria po, liver and gallbladder po yung gan. So, 1, 2, and 3, letter A po.
Okay. Answer is A. Let's go to number 46.
Number 46. Epigastric pain may result from retention of food, invasion of capital food, young, stagnation of liver chi. Lahat po ito, Doc, pwede mag-cause ng epigastric pain. So the answer is letter B. Pag hindi ka natutunawan, masakit ang nalamigan, masakit ang tiyan.
Yeah, lahat. Okay. All. Letter E. 47.
47. Insomnia caused by a failure of blood to nourish the heart and the deficiency of both heart and spleen is often accompanied by mental restlessness, dizziness, gastric discomfort, and palpitation. With deficiency of the heart, deficient ang blood, definitely ng zero. Nagkakaroon ng palpitation. 2 and 4, kasi yung mental restlessness associated with the liver. So the answer is letter C. Pero parang kasi dalawang insip ako dito sa gastric discomfort, Doc, kasi di ba spleen nasa deficiency sa spleen, di ba magkakaroon din ng gastric discomfort yun?
Spleen eh. Spleen yan eh. Will you associate gastric discomfort with the spleen?
Or more on the stomach?
More on the stomach. So what is your answer? Number 4 or both 2 and 4?
2 and 4. Letter C.
What is causing the dizziness here?
Ayun po, Doc.
Bakit may dizziness?
Kasi kung deficient yung heart, usually deficient heart blood po yun, Doc.
Okay. Very good. You got it. Galing nyo talaga. Okay. Number 48.
Number 48. Insomnia due to hyperactivity of the fire of the heart is often accompanied by mental restlessness, dizziness, dream disturbed sleep, and palpitation. So, pagka-disturb ang heart, natural merong mental restlessness, and then may dream disturbed sleep.
Okay,
So,
can you explain?
Dito, Doc.
So hindi kasama si dizziness dito?
Oo, hindi kasama si dizziness. So 1, 3, and 4, wala naman sa options na ganito, Doc.
Ay, oo nga pala. Oo, pero dapat may ano.
Kasama palpitations kasi, di ba? Heart five po yan eh. So, anong answer natin? 1, 2. Ang answer ko po 1, 3, and 4.
Dapat kasi ano eh. Wait lang ha. Analyze natin. Can you explain the pathology behind this? Okay, like anong kinalaman nito? Like bakit nagkaroon ng mental restlessness and dream disturbed sleep? Pag may
Nagmumula po yan sa ano to?
like ano nangyari dito?
Sa liver.
Hyperactivity of the fire of the heart. So there's too much heart fire. So when you talk about
Parang yung siya, hindi nakaka-restless niya.
yeah. Okay, would somebody like to help? Dr. Sam, would you like to comment? What is your answer here?
Yes, actually, Doc, it should be, dizziness should be included.
Yes.
Because kung meron kang hyperactivity or fire on the heart,
Yeah.
dalawa po ang magiging sanhi po niyan eh.
At saka may ano na siya, may heart fire, di ba? May palpitation
heart
siya
fire.
dapat. Eh wala naman tayong choice na 1, 3, and 4.
Wala.
At saka syempre pag may ano ka na, like dizziness yan eh. And
Yes.
so the correct answer should be letter E. Any comments? Oo, kasi pag ano, hindi mo pwedeng sabihin na heart siya eh, pag walang palpitations. And this is hyperactivity of the heart fire. So the answer should be 1, 2, 3, and 4.
4.
Kasi dito sa una nating ano, sinabi ni Ma'am Lynn, may dizziness eh. Oh. Okay. Yung ba yun? Okay. Oo. So, una-una ba, paano siya naging ano? Most probably, nag-umpisa siya as blood deficiency of the heart, right? Then naging heart yin deficiency, and then nagkaroon ng fire, right? Heat, empty heat, then fire. Okay. So all of the above. Number 49, Ma'am Lynn. We're almost done.
Pila po yung slide nito.
Yeah, lethargy.
Letter G will result from deficiency in stagnation of chi of phlegm in the area. Letter G.
Okay, very obvious yung number 4, di ba? Kasi phlegm dump eh. Bigat na bigat yung pakiramdam niya, tapos dump na dump. Phlegm dump, as in double kill, di ba? So lethargic talaga siya. So it could be number 4. And why did you answer yang deficiency?
Kasi pag yung deficient, parang wala ka rin.
Para mo na rin sinabi may chi deficiency.
Walang limit ang katawan.
Okay.
Parang ganun.
So 2 and 4. Do you agree, Dr. Sam?
Yes, Doc. Okay po yan.
Okay. Number 50.
Excessive heat in the blood may result in menses, a shortened cycle, deep red in color, quality. Lahat po yan, Doc, pag excessive heat.
Shortened cycle. Ibig sabihin, grabe yung bleeding niya, no? Shortened cycle lang. Siguro after 1 week, bleed ulit. Okay. Paul. Maraming salamat, Ma'am Lynn. Ingat ka dyan sa, sa QC. Maulan pa rin. May bagyo na naman yatang parating. Diyos ko,
Yeah.
Okay, thank you po. Let's go to Dr. Sam. And before we start, okay, Ma'am Teresita, would you like to join 61 to 71?
Yes po, Doc. Try
Very
lang.
good. Okay. Para kumpleto na tayo. Tapos matatapos na. Okay, Dr. Sam, please.
Yes, question number 51. Good evening, everyone. So I'm glad to be back.
Yeah, welcome
Stagnation. Stagnation of blood may result in prolonged menstrual cycle, low abdomen pain with intensifies on pressure, all that. Scanty purplish dark discharge of or blood clots, and watery urethra. Now the answer is simple. Stagnation of blood is supposedly magkakaroon ka talaga ng prolonged menstrual cycle. And there will be a pain in lower abdominal. Pagka in-apply mo ng pressure, sumasakit talaga yan. That is because of the stagnation. And scanty purplish dark discharge. The dark discharge or clots, it simply means a blood stagnation.
So what is
But
the
not
yeah, very good. So if you have of course female patient, my menstrual issue, what will be how will you differentiate blood stagnation from blood heat in the blood, excessive heat in the blood?
Well, excessive heat in the blood, well, the color of the blood, it should be
Right.
sharp red,
Okay.
bright or bright red. Yeah, that's the correct
And what
answer.
about
And then
the menstrual cycle? Nakikita
and
niyo
yung
yung difference? Pag excessive heat in the blood, the amount is excessive, thick in quality. Whereas blood stagnation, because, blood tends to stagnate, scanty siya, and the color is purplish. Saka blood clots. Okay? And when you apply, when you palpate the lower abdomen, medyo ayaw niyang papalpate, masakit. So doon pa lang. So you should be asking these questions that will lead you to the diagnosis. Okay?
Uh-huh.
Very good.
Yes, yeah, yes, that's actually the yung problema ng anak kong dalaga.
Ah, okay, good.
Yeah. Because something wrong with your liver.
Yeah. Baka naman, sa dami ng masasarap niyang pagkain.
Yeah, mahilig sa cold, Doc.
Oh, okay. So that's good. So, specialize on women's disease. Ano ba to? Menstrual issues. Ang daming ganyan, lalo na mga bata, no? The kind of
Yes.
food that they eat. Okay, number 52.
Okay, slow pulse indicates, actually it's a cold syndrome. So I could not say it's an exterior syndrome because exterior syndrome that's supposed to be floating. Okay,
Okay.
that could be floating rapid, floating tight for the wind cold.
Mm.
Now, interior syndrome also, the pulse should be deep. And the heat syndrome, the pulse should be rapid. So the answer should be number 4, cold syndrome.
Okay, very good. 53. Oh, this is all about pulses. Okay.
Yes. Rolling pulse, I think it's the same as slippery.
Yeah.
Slippery.
Slippery.
Pag slippery yung pulse, that is actually phlegm. Retention of phlegm, and then retention of food, that mayroong indigestion. So excess heat and pregnancy.
Yeah.
Pregnancy. Pregnancy.
So all.
Yes, letter E.
Okay, very good. 54.
All right, hesitant pulse.
What is another name for hesitant pulse?
It's choppy.
Wow.
It's choppy.
Very good. Choppy.
Okay, the choppy pulse is actually a deficiency of blood. So
Okay.
mayroong impairment din sa essence. And kung mayroon pong deficiency sa blood, hold on, that could be another stagnation of chi.
Yeah.
Kasi magkasama po yung blood at saka chi.
Okay. Okay.
And then stagnation of blood. Everything is the right answer, 1 to 4.
Okay. So I presume you have observed this in some of your patients?
Yes, Doc.
Wow. Okay, number 55.
Pathogenic phlegm dump may be reflected by pathogenic phlegm, that is a rolling pulse. And then we have the string taut pulse.
What is another term for this?
Yung parang string, kalimutan ko, Doc.
Alam mo yan, starts with a W.
Yeah, it's wiry.
Okay.
It's wiry pulse. So it's phlegm dump that would affect the liver as well. So soft pulse. And the right answer for that is, so if we have phlegm and dump, it will result also, and dampness, it will result of heat.
Okay.
So I think the answer is rolling, wiry, and soft. So rapid is not involved because wala pa pong heat dito.
Okay. 56. Ito na yung wiry.
Okay, ito na yung wiry. A wiry pulse indicates disorder of, we know for a fact it's a disorder of liver and gallbladder. And we have painful syndromes and then retention of phlegm.
Okay. What type of pulse would you expect in yin deficiency?
In yin deficiency, the pulse will be thin.
Okay. Galing. Okay, 57.
A thready pulse or thin
What is another
pulse.
term for thready pulse?
Actually, it's thin
Okay.
pulse.
Okay, yes. Okay, good.
It's clearly deficiency of yin. Nansira natin kanina. So deficiency of yin, and because of the excess heat na tawag nito, yung ating fluids is actually na-consume na, no? Kaya
Mm.
nagkaroon na siya ng yin deficiency.
Okay.
So, deficiency of qi and blood as well.
Ah,
So the answer is gonna be 1, 2, and 3.
okay.
So that's letter A.
Spleen disease, definitely it's not ready.
Hindi ready po.
Anong pulse?
Kasi kung mag-spleen disease ka, magkakaroon ka ng food stagnation also.
Okay.
So the pulse would be something like rolling.
Okay. Great. Number 8, 58.
Okay, the pulse which indicates a deficiency of both qi and blood would be pulse which indicates a deficiency of both deficient qi and deficient blood. Okay, that's gonna be thready, thin pulse because it's blood deficient, and weak as well kasi deficient din po ang qi. And then deficient pulse, yes, deficient pulse, but not slow because this is not actually cold.
Yeah, very good. 59.
Stagnation of blood results in immovable hard masses in the abdomen, pain at definite site. So stagnation, yeah, definite site, yung steady lang po yung pain.
Mhm.
And pricking pain, so parang stabbing pain.
Yeah.
And of course, a hesitant pulse. So everything is the right answer, 1 to 4, and that is letter E.
Okay, very good. Number 60.
A superficial and tense pulse, oh, this is exterior. So superficial and tense pulse is we can expect exterior heat syndrome, or tinatawag po natin na floating rapid ang pulse.
So hindi siya superficial and tense.
This is superficial and tense. So hold on. Yes, hindi siya. Okay, the number.
What do you expect sa exterior heat syndrome? What type of pulse?
Sa exterior heat syndrome,
Superficial
the
and
pulse, yeah, superficial and rapid.
okay. Okay.
So the exterior deficient syndrome, hindi rin po yan. So exterior dump syndrome, hindi rin. Pag may dump kasi, hold on. Pag may dampness siya, it could be something like cold or floating tight.
Done.
So the answer is, I think the right answer is number 4.
Cold,
Exterior cold syndrome. Yeah, superficial and tense.
tense or tight pulse.
Or tight.
Okay. Thank you very much, Dr. Sam. Excellent. Very good.
Thank you, Doc.
Okay, let's go to the last one. 61. I think there are 71. 71 ba? Or 74. Okay, whatever. 61 to 70, Ma'am Teresita.
Good evening, everyone. Good
Good
evening, Doctor.
evening.
Number 61, a deviated tongue often indicates blood deficiency, blood obstruction, qi deficiency, and number 4, obstruction of the channels and collaterals by wind flame. So my answer, Doc, is number 4, letter D.
Okay, very good. 62.
Which of the following symptoms can be categorized as a sign of lung channel? Sore throat, pain in the supraclavicular fossa, cough and asthma, and palpitation. So my answer is 1, 2, 3, which is letter A.
Why did you not answer palpitation?
Because palpitation indicates heart problems, Doc.
Very good. 63.
The change in tongue proper that doesn't relate to heat syndrome includes, my answer is purplish tongue and pale tongue. Because red tongue is heat and then deep red tongue heat pa rin.
Okay. Kasi you can have a purplish tongue kahit cold, di ba?
Opo.
64.
Which of the following symptoms would be the most likely to help make the diagnosis of invasion of the spleen by cold and dampness? My answer here is letter A, distension in the epigastrium, poor appetite, heaviness of the head. So 1, 2, 3. So it is letter A. Because
Okay, answer foul belching and regard.
because belching and regurgitation is an invasion of stomach by cold.
Okay, very good. Stomach. 65.
Congested and sore throat can be seen in syndromes of lung channel, the large intestine channel, the kidney channel. My answer is letter A, which is 1, 2, 3.
Okay. Kidney channel. Yes. Yeah. 66.
Retention of urine or difficult dribbling urination is often due to retention of damp heat in the urinary bladder, insufficiency of kidney yang, presence of stones, and stagnant blood. All the answers are correct po, Doc.
Okay, very good. 67.
Chills without fever may be caused by exogenous cold resulting from a deficiency of defensive qi, endogenous cold resulting from a deficiency of yang qi, invasion of wind heat, and exogenous pathogenic cold directly affecting certain Zangpo organs. My answer here is 2 and 4, letter B, letter C.
So this is not
Chills without fever.
okay. Directly affecting the Zangfu. Okay. 2 and 4. Invasion. Okay, 68.
Night sweating is usually a sign indicating hyperactivity of yang, excessive heat, deficiency of yin. So 1, 2, 3, letter A. Because exogenous pathogenic cold is sa stomach po siya, Doc.
Yeah, okay. So pag may night sweating, yin deficiency cannot control the yang. So there is hyperactivity of yang. Kakano ba ng excessive heat ang night sweating?
Because of heat, Doc.
There is a possibility, no?
Oh, yes po, Doc. Kasi kung excess na ang heat, Doc,
Kasi pwede magkaroon ng fire.
Okay. Ano na siya sa yin deficiency, Doc?
Ma-consume yung yin.
Opo.
Yes. Okay, so A. 69.
Absence of thirst or thirst without desire to take fluids often includes internal heat syndrome, deficiency of yang qi, deficiency of yin, and cold damp. So my answer is letter D, number 4, cold damp. Absence of thirst.
What about deficient yang qi?
There is no thirst, Doc. Because deficiency of yang qi is cold.
So the answer is only letter D, number 4.
Cold damp. Sa interior heat syndrome, din wala din yung thirst, Doc.
Yeah.
Pati sa deficiency of yin.
May thirst sa interior heat syndrome.
Meron ba?
Meron. Heat na siya. Ang question kasi, absence of thirst.
Without desire to drink.
Yes.
So dito sa interior heat syndrome, there is thirst but and desire to drink. Okay, tama po. There is thirst pala.
Okay. So the answer is, do you agree, Dr. Sam? Cold damp?
Yes, Doc. Kasi ano yan, di ba wala siyang desire to drink. So that's a cold damp. Wala ho kasi yung consumption ng yin.
Okay. Thank you. Number 70.
A pale tongue often indicates deficiency of Qi and blood, deficiency of Yin, exogenous pathogenic cold, and deficiency of fluids. My answer here is 1 and 3, letter B.
Okay.
Because in deficiency of Yin, the tongue is normal with scanty or no coating. Sa
Yeah.
deficiency of
It's not
fluid,
pale.
yes po, the tongue is red, dry, and has cracks.
Okay. Thank you. Ang galing. Meron pa ba? Meron pa. Maraming salamat, Ma'am Teresita. Excellent
Tingin
job.
po, Doc.
Let's call on, meron pang isa, hindi ko natatawagan, na medyo late dumating. Si Sir Michael. Sir Michael, you're still awake, I presume? Sir Michael? Naku, nagbibingi-bingihan. Ay, bakit parang wala siyang... Well, anyway. Sir Michael? Naku, tinulugan na tayo. Okay.
Nagko-connect, Doc. Nagko-connect siya. Parang mahina
Nagko-connect.
signal niya.
Saan ba si Sir Michael? Nasa Pampanga? Baha pa daw ang Pampanga ngayon. Mukhang hindi na nagko-connect. Nothing is happening. So can we finish na lang all the questions? Ma'am Teresita, please.
Yes po, Doc.
Sige, para matapos na tayo.
Number 71. An abnormally red tongue often indicates cold, pathogenic heat, dampness, yin deficiency. My answer, Doc, is 2 and 4, letter C, pathogenic heat and yin deficiency.
Okay, very good. 72.
A deep red tongue often indicates pathogenic heat in the blood, yin fluid which has been exhausted, and an endogenous fire which is of the deficiency type, is hyperactive. Then number 3, pathogenic heat has been transmitted from the exterior to the interior of the body. Then number 4, blood stasis. So my answer is letter A, 1, 2, 3.
Yeah, hindi blood stasis, no? Okay.
Yes po, Doc, because sa blood stasis, the tongue is purple.
Yeah, always. Let's go to number 73. 2 more.
An enlarged tongue which is pale in color and has tooth prints on the border indicates deficiency of Qi, deficiency of Yang, retention of phlegm damp in the interior, and deficiency of blood. So my answer, Doc, is letter A.
Okay. Definitely hindi enlarge ang tongue sa blood deficiency, no?
Yes po, thin po siya, Doc.
Okay. And finally, the last one.
Irregular streaks or cracks on the tongue indicate consumption of body fluids by excessive heat, hyperactivity of the fire due to a deficiency of yin, loss of the essence of the kidney, and pathogenic dryness. So my answer is letter A, 1, 2, 3. Because in pathogenic dryness, there is cracks all over the tongue body.
Okay. Yeah, very good. Congratulations po sa lahat. You all did
Thank you,
well.
Doc.
And we're moving forward. Huwag na tayo magpahinga, diretso na tayo kaagad kasi bumabagyo, no? Okay, before we leave. Kasi dapat, let's maximize everything, no? And so, are you excited to go to Module 3?
Module 3 na tayo, Doc.
Yes, we're going to start next Friday. Yeah, on this coming Monday. Okay, tanungin natin si Sir AK. Mukhang ang dami ng alam ni Sir AK. So far, how are you? How are we doing? Are we doing great, Sir AK? Madami.
Yes. Yes, Doc. Marami pang dapat pag-aralan.
Ay,
Pero marami na pong marami na pong natutunan kahit paano mas confident po tayo ngayon. Pagdating sa sa TCM. Kumbaga mas nakikita na natin yung lawak ng dapat pag-aralan pa. Tapos kung ano po yung alam natin.
Nag-level up na ba tayo? Like tayong lahat?
Yes, Doc.
Yes, Doc. Yes, Doc.
No. Back here.
So
Kasi
ganito,
magaling ang ano.
hindi magaling kayong lahat as in.
Magaling ang
Anyway,
ang
ituloy-tuloy na natin to. We will
professor.
probably end the module 3 by October 13. So that's another 10 weeks. Grabe no, parang kahapon lang. We've already consumed 20 weeks. No?
Parang wala lang.
And thank you for your persistence. Kahit absent yung iba, naralaman ko naman kung nag-aaral din ba, no? So, maraming salamat. So next, we're supposed to have a break, but if you have a copy of the curriculum na ginawa natin, wag na tayo mag-break. So third one would be all about the patterns, all about syndromes.
Yeah.
So we will bombard you with a lot of actually, it's easy, no? Pero para medyo mabago naman, dahan-dahan na natin matututunan yung mga treatment principles. Para pagdating natin sa Module 4, Module 4 is all about needling and mastery of the acupuncture channels, the points, and extra points, which we are required to have memorized 44 extra points. And I'm not so sure about how many points, pero nakita ko sa dami ng natutunan nyo, mukhang ano, no? This is not about memorizing the points. It's about really getting acquainted with the categories, no, point categories. And I do not want to see anyone from this group saying na, ano, bakit hindi niya alam yung mga 5 shoe points, no? So we would like you to be very, very accurate in your, like every time you talk about the point, because what we would like to happen is when you get to see patients already, by the time you become CAA or CA, may explain nyo sa mga pasyente ano yung mga points, no? And they deserve to know that. I'm so impressed by your grasp of the diagnostics. So congratulations everyone. Makakatulog na tayo ng mahimbing. And I'm very confident na may patutunguhan itong ating paghihirap. And I'm very thankful that you chose Slump to be your partner in your hopefully going to be flourishing career. And let's show the world that we exist. Let's try to be globally competitive. And the only way we can do that is to spend more time. And I believe that this is the kind of training that you like. And I find this more effective, diba? So tanungin natin si Sir AK, how is do you like this kind? Or would you like, kasi dahan-dahan ko na kayo i-revalida para pag sa actual na mukhang, ano,
Sorry.
okay lang. So, yun. So, maraming salamat po. And will I see you again next week?
Yes.
I will be posting the things that you have to study for the week. So we have like 10 weeks. We're going to probably talk about, I don't know if we can go by organs or we can go by kasi ang dami-daming ano like how do you diagnose, no? Via pathogenic factors ba, via the Zhang-Fu, or via the eight principles, yung mga ganon, no? And we want you to excel in all of them. And I hope I'll try to talk to the board, no? Para ma-awardan din natin yung pinaka, yung konting ano lang din. And we hope we can come up with something. And I'm sure if Dr. Palanca were alive today, she would have been very proud of all of you. And hindi ko sinasabi na without your support, without you doing your part, no, I don't think this program is going to be successful. So importante lang dito is persistence, perseverance, and always be positive, no? Because we would like to see ourselves aligning with the medical people. Yan po talaga yung pangarap ni Dr. Palanca. And malapit po sa puso niya yung mga taong, yung gustong matuto and gustong mag-level up. So with that, I'd like to thank everyone for joining. Enjoy I don't know if we can enjoy at this time. Pero na naman parating. How is the weather in Cavite, Dr. Sam?
Well, continuous pa rin ang ulan, Doc. Actually, nagkakaroon kami ng intermittent internet signal. At nag-brown out nga kami dito. Akala ko nga, di nababalik eh. Patuloy pa rin ang malakas na ulan at tumitigil naman. But it's sad to know na meron na namang coming
Yun nga
typhoon.
no? Grabe. But anyway, basta keep safe lang lahat. Kaya nga maximize na natin. Kahit mawala yung internet, tuloy-tuloy na tayo. Sana nga wala, no? I hope the weather will cooperate. And you have all done so, your performance tonight was very good. Sino pa ba? I think all of you have participated, no? Si Ma'am Ami, tanggalin mo yung nervyos mo. I know you know what.
Yes, Doc.
I know you have so many things in your head. Ma'am Lynn, I love the way you answer your analysis of the question, no? Of
Yes.
course, Dr. Sam, walang So, and of course, si Sir AK na talagang kinareer na yung pag-a-AQ. Ma'am Angel, of course. Ma'am Angel, thank you so much.
Thank
And
you, Doc.
yeah, Ma'am Lane, actually nire-revalid ako na kayo no? I was thinking mukhang hindi na kailangan mag-revalid. And sino pa ba? Of course, Ma'am Teresita. And then si Sir Michael mukhang natulog na yata kahit late dumating. But anyway, okay lang po yon. So welcome to Module 3. Then Module 4 is all about mastery of the points and needling techniques. And then Module 5 is all about clinics. So we'll be dealing with all the cases and we'll probably infuse techniques on how to examine patients, both the Eastern and Western modalities. Okay? And then the rest will be clinics. We're very confident that this is going to be successful. Thank you so much for your support and imagine na natin na award na tayo ng ating certificate by itatapat natin sa ni Doktora September 11 sa kanyang birthday. So we hope mabilis lang ang araw no, grabe. Like 1 year more, we're good. Actually you're ready na no? You're all ready. So thank you Dr. Gavino. I'm sure nakikinig siya ngayon. Huwag kayo matakot kay Dr. Gavino. Pag nabudol kayo, ibig sabihin kulang yung ating no? So huwag tayong pabubudol. Pabubudol ka, ibig sabihin hindi pa tama, hindi pa enough yung inyong natutunan. Okay? Maraming salamat Dr. Gavino. More power and I hope hindi ka pa tuloy-tuloy pa tayo. So maraming salamat everyone. Good evening, good night. Enjoy your weekend. See you again next Friday. Thank you po.
Good night, Doc.
Good night.
Thank you po.
Good night,
Good night.
everyone.
Ingat kayo. Pray hard. Bye-bye.